So basically, neuropathic pain is a maladaptive pain which results from damage to the nervous system, which may be peripheral nervous system, dorsal roots, and maybe central nervous system. And it is a complex syndrome which can have negative and positive phenomena. The negative symptoms are the sensory deficits such as partial or complete loss of sensations, and the positive symptoms, they include dysesthesia, paresthesias, and severe pain. Symptoms, you see, it may be in the form of persistent or paroxysmal pain that is independent of stimulus. There is no stimulus, but patient can have persistent or paroxysmal pain, and it can be shooting, it can be lancinating or burning depending upon the activity of the sympathetic nervous system. Spontaneous activity in nociceptor C fibers is thought to be responsible for the persistent burning pain. Spontaneous activity is largely in myelinated A fibers is related to stimulus independent paresthesias. Stimulus evoked pain, common component of peripheral nerve injury or damage, and it has two features, hyperalgesia and allodynia. Sometimes it is so difficult, the patient cannot describe it the way you read it in the books. So these are the few actual how the people describe. They feel that I feel as though someone has pulled the skin of my left arm and is then constantly rubbing salt into the wound. So this is the patient's own way of description of the pain. The other person may say that I feel as though my leg is on fire, my skin feels burned, and it is as tough someone is taking a claw and tearing into my skin 24 hours a day. You can imagine the intensity of the agony. And other way, that I feel as a tough someone has taken a hot poker knife and is jabbing deep into my right eye. The neuropathic pain syndrome can be peripheral nervous system, which is focal and multifocal lesion. It can be peripheral nervous system with the generalized type of polyneuropathies, and it can be central nervous system lesion, and then complex neuropathic disorders. Previously also the slides were being shown, so you can see these are the type of the focal and multifocal lesions, and this is very important, post-herpetic neuralgia and trigeminal neuralgia like this. And then these are the generalized polyneuropathy, in which is the diabetic polyneuropathy is the most important, and of course autoimmune Guillain-Barré syndrome, and as a paraneoplastic syndrome in case of malignancy. And these are the central nervous system lesions, spinal cord injury, especially prolapsed disc, cervical spondylosis, multiple sclerosis, and certain surgical lesions. And then these are the complex neuropathic syndromes, which can be type 1 or type 2. These are the common most causes of neuropathic pain. Among the diabetic neuropathy and post-herpetic neuralgia, and of course cervical and lumbar radiculopathy, they are at the top. As the slide has been shown by Brigadier Salim, you see this. This is the small, you see, questionnaire which you can put, and from here you can make up your mind that it is a true neuropathic pain. See, there is one marking for each, and if it is a known joint pain, it carries -1. And it is said if the score is equal or more than 3, then most probably it is neuropathic pain. Different assessment tools are already shown by Brigadier Salim. So management, I will talk of pharmacological management. You see, these are non-opioids, opioids, and then the adjuvant analgesics. These are the interventions, therapies which Brigadier Salim has told in detail. This is a logarithm. This you can see. You see, when there is neuropathic pain, so is it post-herpetic neuralgia and other focal neuropathy? If it is yes, then lignocaine patch can be more effective. If it is no, Then you have to see whether there is any contraindication to tricyclic antidepressant. If it is yes, then start with gabapentin and pregabalin. And if there is tricyclic contraindication again, then you can go to the, if it is not improving with that, you can go to the opioids analgesics. Or if there is no contraindication, then you can use combinations can also be used. So these are again the same group of medicines. These are the anti-epileptic medicines. They are very important and very commonly used. Antidepressant, opioids analgesic like tramadol, and then these are the local. Then this is complementary therapy in the form of acupuncture, nutritional counseling, and massage therapy is very important. And these are certain other types other than there is a rehabilitative approaches, and psychological intervention is very important because as Brigadier Salim has already said that acute pain, there is anxiety along with it, and in chronic pain there is always depression along with the pain. So you have to use these approaches along with the these are few commonly used medicines. So the carbamazepine, the dose is 100 milligram to 1000 milligram. The side effects, you see, they are dizziness, nausea, ataxia, and the contraindications are the liver dysfunction and bone marrow suppression. Gabapentin, again multimodal action, it reduces ectopic activity and central sensitization and decreases glutamate activity. Dose is 300 to 3000 milligram per day. Side effects, dizziness, sedation, weight gain, and contraindication is hypersensitivity. These are just few commonly medicines. I just narrated the dose and side effects. And pregabalin, again 75 to 600 milligram per day divided doses, and these are the side effects, and the contraindication is the hypersensitivity reaction. Tricyclic antidepressant commonly is the amitriptyline. Dose is 10 to 75 milligram, preferably at night time. Side effects are anticholinergic, constipation and confusion, and contraindications are the narrow angle glaucoma, urinary retention, especially prostatic hypertrophy, and the heart blocks. Ketamine, dose 0.5 milligram per kg to 1000 milligram. Side effects are the delirium, hallucination, confusion, nightmares, and contraindication are the hypersensitivity and psychiatric disorders. Again, lignocaine, 5 milligram per kg over 1 hour. Side effects are hypotension and neurotoxicity. Tramadol, opioids analgesic. Dose is 50 milligram to 400 milligram per day. Side effects are sedation, nausea, and contraindication are hypersensitivity or excessive drowsiness. This is, you see, special type of medicine where the others are not effective. You can use this, and these are the common side effects which can happen to these people. So a stage comes where you use multiple drugs, the patient may become resistant to it, and the neuropathic condition is resistant to pharmacotherapy when mono or rational combination treatment using drugs proved efficacious in RCTs fails in inducing pain. कि लिटरेचर में तो कहते हैं कि पेन को रिलीव करते हैं, लेकिन उस पेशेंट में वो इस्तेमाल करने से रेजिस्टेंस हो जाती है, एंड द पेशेंट डज नॉट फील रिलीफ. So the drug failed to produce the response and produces intolerable side effects. So the quality of life is decreased, symptom increases, and because of excessive medication, it is very expensive. So to conclude with, as I said earlier that I will be brief, I hope I was brief. So more effective medical therapies for neuropathic pain are becoming available, and physicians should use them to limit necessary suffering with ultimate goal of significantly improving patients' quality of life. With this, I thank you very much